In last lecture, as per the curriculum, we had seen about the toxicity, lethal dose, dose versus doses, and other relevant information. After LD50, as per the curriculum, there is an acute, subacute, and chronic toxicity studies prescribed in the pre-PhD course of the curriculum. So let's start. Could share. Otherwise, I could give an example of such tragedy which has been studied by all of you in the same subject, that is pharmacology, introduction of the pharmacology, because of which the concept of teratogenicity came into the existence, and that was the example of thalidomide. I hope all of you might have been recalled. And afterwards, the profiling, toxicity profiling of chemical or pharmacological agent has increased. There is still not enough information on the toxicity of some of the currently used agents, and that is why this study of these contents of your syllabus becomes very important and essential. The pharmacological or the chemical agent are developed either from the synthesis or semi-synthetic processes, or they may be of natural origin, that is plant-based development. Although these agents have played a remarkable role in improving the human health quality, as stated through the traditional or folklore medicine, although, sorry, even then, they are not totally safe as we consider or say most of the time. Therefore, there is a provision to include toxicity test for these agents with the purpose of ensuring that these agents are relatively safe at a therapeutic dose or intended dose for the use before they could be used as a medicine or for any other purposes like food or additive to the food, etc. There are various levels of toxicity test. However, acute, subacute, subchronic, and chronic toxicity are the most commonly assessed. With this brief introduction, the importance of this particular topic, either in your syllabus or which I am going to present today, might be very clear. So this presentation will unveil a simple stepwise method by which toxicity tests from acute to chronic level can be carried out in animal models, which of most of the research literature or thesis or dissertation. Let's start with the acute toxicity test. This test is divided into or proceed to the next level. Stage 1, this stage requires 4 animals consisting of 2 different strains. This is mandate, nothing modification or changes can be made. These animals are divided into 4 groups of 1 animal each. As you can see in the table, this is a very precise table to explain from a single table. This table has been created. So here 4 groups, and in this 4 group 1, as you already know, that 2 different strains of animals are used in among these 4 groups. So group 1 and 3, that is even and odd, we can also say like this, consist of same strain. That is group 1 and group 3 animals are of same strain, while group 2 and group 4 animal are of different strain. Different dose of the test substance as shown in this table are administered to the animals. From the lower dose it has been started, and that is why stage 1, so that we can proceed to the stage 2, has been consisting of variety of the doses. So the animals are kept under intense observation for an hour after the administration of testing substance, and then for the 10 minutes at the interval of 2 hours for the period of 24 hours. Means immediately after the administration, continuous observation has to be made for that testing animal for an hour. Then afterwards, on each 2-hour interval for the 24 hours, 10 minutes each, observation has to be made for observing the behavioral signs of toxicity, and also mortality are recorded. Where there is no mortality recorded, the assessment proceed to the stage 2. Stage 2, this stage involves 3 animals. From this table itself it is clear. In stage 1 only seeing the 4 groups, that is 4 animals, while from stage 2 onwards there are 3 animals. This stage involves 3 animals consisting here also 2 different strains. The animals are divided into 3 groups, 1 animal in each group. Animal in group 1 and 3 are same strain, while in group 2 will be of different strain as explained or stated earlier. Higher doses of the test substance are administered to the animals. What it means, as already you have seen in the table 1, the stage 1 doses are below 1000. In stage 2, 1000, 1500 and 2000 respectively. And that is why it is mentioned higher doses of the test substances as given the table are administered to the animals, and then carefully observed for 1 hour after administration, and periodically for 20 hours, minimum for 10 minutes in each observation, as already explained to you. And same way as we have seen in case of stage 1, behavioral signs of toxicity including mortality are recorded. If no mortality, then the assessment proceeds to the stage 3. So stage 3 consisting of more higher doses. As you can see, it may go up to the 5000, 3000, 4000 and 5000. So careful observation is performed for 1 hour of post-administration, and same way as already told to you. I think till this stage 3, there might be no any confusion, which is exclusively based on table 1. whatever the result in acute toxicity studies, that has to be confirmed, or it is known as the confirmatory or confidence test. How practically will you proceed for this? Let's see. The test, that is confirmatory or confidence test, involves the administration of the lethal dose or lowest lethal dose in situation that recorded more than one mortality. So here the number of animals for the confirmation test, as we had seen in case stage 1. In stage 1, what we had did in the stage 1, there were 4 animals. And in stage 2 and 3, the animals were reduced. And for this confirmatory test, only 2 animals. The number of animals are continuously reducing. So 2 animals, and both the animals are of different strain. Observation will be done as already stated in stage 1, stage 2, and stage 3. That is, after administration of the post-administration for 1 hour, then at the interval of 2 hours for 20 or 24 hours, up to the period of 24 hours, 10 minutes. Observation for minimum for 10 minutes. If an animal, irrespective of strain, from the 2 animals, out of 2, if anyone die, it serves as a confirmation and validation of the test result. Furthermore, if the main test did not show any mortality, because the highest dose stage 3 was 5000 mg per kg, even then confirmatory test has to be performed. And this involved administration of 500 mg per kg to 2 animals of different strains, and the vehicle in which the substance has been administered or treated, that has also properly supported. The choice of the vehicle should also be properly supported on the basis of LD50 values. So how will do the calculation? There is a formula. The formula for the calculation of LD50 is expressed below. LD50 is equal to M0 plus M1 divided by 2, where M0 is the highest dose of test substance without mortality, while M1 is the lowest dose of the test substance that gave mortality. I hope it might be clear. Then let's come to subacute toxicity test. If agent or pharmacological agent or the substance chemical acute test, then the acute toxicity test is continuation of the acute toxicity test. So it is a continuation of acute toxicity test, that is subacute toxicity test, mainly involves the continued observation of the test animals acute toxicity for a longer period. So test substances are administered. So here the duration, the careful observation duration for 14 days is kept. Subacute toxicity test. Sign of the toxicity and the mortality are recorded if any is observed, just as during acute toxicity test, where mortality is observed within 14 days of observation. The dose that gave mortality or the lethal dose in a situation that recorded more than 1 death is administered to 2 animals. So as we had seen previously in the previous slides, similarly, Subacute toxicity test is also same. The number of animals will continue get reduced in later phases. So the observation of a single mortality of any of the animal within the period of observation is a confirmation of its subacute toxicity at that dose. That could be calculated by this given formula. Lethal dose, subacute, MO, M0 plus M1 divided by 2, where M0 is the highest dose of the test. Substance without mortality after the subacute test. While M1 first dose of the test is almost similar to the previous calculation method, and similarly the process will go on for other test, that is subchronic toxicity test. So for subchronic toxicity, at least 3 dose levels are recommended for this test, and these 3 doses used to be calculated or determined by using this formula, which is there screen, that is dose equal to M0 divided by 1 plus K. M0 already known to you, the highest dose of the test substance without mortality after subacute test, where A, positive real number starting from 0 with an increment number of 1, that is K maybe 0, maybe 1, maybe 2. So for 3 respective dose levels, on the basis of this, dose used to be calculated and the dose used to be followed. So for subchronic toxicity, 10 animals consisting of equal number of 2 different strains, 5 of this strain, another strain for each group. Along with this test group, control group is required, and this practice is also very well to all of you. Doses are administered for a period of 30 days, where control group only receive vehicle. Observation of all animal is done on daily basis. Earlier we were going for hourly basis or bi-hourly basis, but here for subchronic toxicity, daily basis observation is to be made, and for this daily basis observation, same time has to be fixed, which has to be repeated on a chronicle cycle of about 24 hours. Signs of toxicity and mortality are also recorded as recommended in previous test. The mortality of 2 animals from the same strain in a particular group indicate toxicity at that dose. So out of 10, 2 animals death of the same strain, not out of same strain means out of 5, because 5 of one strain, 5 of another strain among these 10 animals. So उन 5 में से among those 5, the death of 2 animals indicate the toxicity of that dose. So at any time when mortality is observed, the vital organs like kidney, lung, liver, heart, spleen, small intestine, stomach, duodenum, adrenal gland, etc. of such animal are isolated immediately for histopathological examination. At the end of the period of the administration, 4 animals, 2 from each strain, from each group, including the control group, are sacrificed. Means these are those animals which has successfully tolerated the given dose and didn't die. They are sacrificed 6 hours after the last administration of the dose, and the vital organs, as stated above, kidney, lung, liver, heart, skin, small intestine, stomach, duodenum, adrenal gland, etc., are isolated for histological examination. The histology of test group, control group, during the period of study, if there is a mortality, or sacrifice after the completion of the study as per the instruction or the guidelines, they are compared. So this comparison is made against the control. Signs of organ tissue damage is observed and are recorded. The calculation is done as per the previous formula of subacute. Here we'll mention lethal dose instead of subacute. The subchronic remaining formula will remain same. Whenever you are attempting, you have to write or repeat the same formula by mentioning the subchronic. The M0, M1 will remain same. So this is the subchronic toxicity, and after the subchronic toxicity, there is a chronic toxicity. So chronic toxicity assessment can only be carried out for test doses that pass the subchronic test. So similar fashion as we had seen after the successful completion of the acute, the subacute was performed. Then after subacute, on the similar guidelines, subchronic was performed, and similarly on the similar guidelines, so it has to be carried out for test doses that pass the subchronic test. It begins 24 after administration of the last subchronic dose. 6 animals each, consisting of 3 animals per strain. How it is there? Because from the previous explanation, I am audible?
Yes, sir.
Screen is also visible? Please confirm.
Yes, sir. Yes, sir. Yes, sir. Yes, sir. Confirm. Clear, sir.
Okay. So as you remember, in previous subchronic test, there were 10 animals, 5 of each strain, and after the completion, the last subchronic dose administration, when all were alive, 2 were sacrificed. The remaining animals become 3, and that is why consisting, here it is mentioned consisting of 3 animals per strain. So purposely 2 animals are already sacrificed in the previous stage of the same test doses, which has been carried forward for the chronic toxicity. So that is why there should not be any confusion, and it is not a quite tough also, but it is a totally theoretical, and that is why just you have to be little cautious. There will be no difficulty to understand. Things are very easy. So administration of the test dose to the animal in the respective group is continued for a period of 62 days. So previously the subchronic was for 30 days, and this is for the 60, and the total duration become 92 days. While the control group animal still received the vehicle, because we had already sacrificed 2 animals from the control also, and that is why the number of animals will also remain same, 3. So all animals in the respective groups are carefully observed daily, as we had seen, did in the previous subchronic toxicity test. Weight taking is also done at 2-week interval. Mortality and other signs of toxicity are recorded. At any time, if mortality is observed, as stated in the previous slide, the vital organs, kidney, lung, liver, heart, spleen, small intestine, stomach, duodenum, adrenal gland, etc., of such animal or animals should be isolated immediately for the histopathological examination. At the end of the period of the administration, that is after 92 days, all the animals are sacrificed 6 hours after the last administration. Previously, we had sacrificed only 2 animals, but here, now out of 6, if all are alive, all has to be sacrificed. There are little modifications, certain scientific events that has not been coded over here. So the vital organs, as mentioned above, are isolated after the sacrification, completion of the chronic toxicity. For the histopathological examination, the histology is compared with control, as already told to you. Signs of organ tissue damage are recorded. So the calculation. So here you are also seeing the same formula. The LD chronic is equal to M0 plus M1 divided by 2, highest dose, lowest dose. M0, highest dose of the test substance without mortality after the chronic test, and M1 is the lowest dose of the test substance that get mortality after the chronic test. So in this way, we calculate the lethal dose chronic. So this is very simple stepwise method by which practically you can perform during your research work. This mandatory to most of the scientific studies, and this is particularly more explained on the basis of the OECD guidelines, which is also there in your syllabus. A very tedious type of guidelines most of the students or scholar feel had been simplified so that you can understand and could be also utilize similar guidelines for subacute and the chronic, subacute and acute toxicity studies. So here very latest OECD or OCDE 452 chronic toxicity study guidelines has been selected to explain it in a much more better way, which was adopted on 25th June 2018, so that there is a more better understanding regarding such type of toxicity studies. So let's start with the introduction of this chronic toxicity study, OECD OCDE 452. So this term you may see TG term, which is not at all related with the abbreviation testing of chemicals, and that is why most of the time when you study the literature get confused, and that is why purple has been mentioned over here. OECD guidelines for the testing of chemicals. The testing of chemicals is abbreviated as TGs. So are periodically reviewed in the light of scientific progress, changing assessment practices, and animal welfare consideration. This original guideline, OECD 452, was adopted in 1981. And today what you are seeing in the present scenario on the basis of change practices and animal welfare consideration, scientific progress is as follows. So this guidelines focuses on exposure via the oral route in rodent species. thermal or inhalation necessary but not mandate. The objective of such study covered by this test guidelines include identification of the chronic toxicity of pharmacological or chemical agent, the identification of the target organs, characterization of the dose-response relationship, identification of a no observed adverse level, that is known as the NOAEL, no observed adverse effect level, or point of departure for establishment of a benchmark dose, known as the BMD, benchmark dose. The prediction of chronic toxicity effects at human exposure level are also used to be concluded after the completion of such toxicity studies following the given guidelines. To test hypothesis regarding mode of action is also the important conclusion in this particular guidelines. Determination of chronic toxicity should only be carried out after initial information on toxicity has been obtained from repeated dose, 28 days and or 90 days toxicity test, as stated in the previous slides. This OCDE 452 guideline states, this statement has been put here without being modified. So first I will read it out and then I will make you understand what it states. In studies involving repeated dosing, when an animal shows clinical signs that are progressive, leading to further deterioration in condition, an informed decision as to whether or not to human kill that consideration as to the value of the information to be gained from the maintained condition. If a decision is made, the animal on test, the frequency of observation should be increased as needed. It may also be possible to temporarily stop dosing if it will relieve the pain or distress or reduce the test dose. So what it states? It states that in this study, repeated dosing pattern is followed. That is already known to you on the regular interval basis. The dosage has to or there is a deterioration in the condition, then decision has to be made. What decision? That let this animal to suffer or not to suffer. If not to suffer, then humanly kill. And if there is a decision, then let it continue. Then close observation for more frequent observation time period has to be made. duration may also be chosen. I was knowing that immediately after hearing this 12 months, some question might be arise in your brain, as previously it was stated for the 92 days. So that is why the further statement as per this OECD 452. Longer or shorter duration may also be chosen depending on regulatory requirements or specific purpose of the monitoring. Deviation from exposure duration of 12 months should be justified, and that has to be explained to institutional animal committee members. Particularly in case of shorter duration, the test chemical is normally administered by oral route. So this particular testing is more with a reference to the oral route of administration. Although the testing by the inhalation dermal, as previously stated in the first slide of OECD 452 guidelines, could also be performed. The study design may also include one or more interim kills. For example, at 3 and 6 month interval, an additional group of animals may be included. During the period of administration, the animals are observed closely for sign of toxicity. Animals which dies or are killed during the test are necropastized, and at the conclusion of the test, surviving animals are killed and necropastized. This is the principle. Now let us describe the method. Let us see the description of the method. First of all, there should be proper selection of animal species, as this particular guidelines or the part of the content in your syllabus is with reference to the preclinical studies. So commonly rodents are used. The preferred rodent species is rat, although other rodent species like mouse may also be used. So it depends. Repeated dose, 90 days oral toxicity study in known rodents could be done under certain regulatory regimes and after proper justification. So known rodents, of course, to get the permission for using the non-rodents, one has to be thoroughly go through the literature, and an additional committee has to be faced to get the permission to study this type of test on non-rodents. The chronic toxicity study should be carried out in animals from the same strain and source as those using the preliminary toxicity studies of shorter duration. The female should be nulliparous and non-pregnant if chosen in the study, or there's a requirement to use. A standard housing and feeding condition should be maintained, that already known to you because it is already there in the curriculum of the B form. So what are the standard housing and feeding condition? Water, specific type of feed, temperature, the dynamic variation, that is day and night maintenance. So that is why the animal house facility is essential. There's a lot many books are there by N.K. Jain or Mittal. Their conditions are they given. Similarly, the practical pharmacology books are also elaborating it and already been studied. This is why not mentioned over here. Preparation of animals, healthy and about 8 weeks old animals which have been acclimatized to the laboratory condition for at least 7 days and have not been subjected to previous experimental procedures should be used. The animal should be healthy, of about 2 months of age, acclimatize at least for 7 days in a experimental environment, and they should not be previously experimented earlier. Each animal should be assigned a unique identification number. That is also well known to you, but here a lot of advancement is there in the unique identification number. Either could be done through the permanently marker, because this duration, this is the maximum duration study, and that is why the marker may sometime not work for this much long duration. And that is why the tattooing is another procedure people are adopting. And with the latest advancement, the microchip implant is the latest technique, or any other suitable method could be discovered or developed by you people also. So let us see the procedure. For rodents, this particular procedure is with reference to the rodents. At least 20 animals per sex, per group should normally be used at the rate of each dose level. If one go for non-rodents, then there is a tremendous decrease in the number of animals, that from 20 to come down to 4, at least about 1/5 or 1/4 number of animals. In studies involving mice, the number of animals increased more than 20 number of animals, or additional number of animals has to be added. So this is what's rodents versus non-rodents, and among the rodents, the first point procedure. The second point of the procedure state that study may make provision for interim kills, at least 10 animals per sex per group, as already stated earlier in the principle. For example, at 6 months, to provide information on progression of toxicological changes and mechanistic information, if scientifically justified or if taking place in the animals because of the testing agent, chemical or pharmacological agents. Where such information is already available, then if there is a certain type of repetition in the same laboratory or on the basis of the existing literature, then interim kills may not be scientifically justified. Okay, so that is why the term if scientifically justified for interim kills, this particular statement has been taken for your kind consideration. Which type of conditions are there where scientifically interim kills are not justified if already such information of the same chemical is available, or if there's a repetition. These animals should normally undergo the same observation, including body weight, food, water consumption, hematological and clinical biochemistry. or desired behavior. Multilation, walking. Animals should be weighed and measured for food, water consumption, food efficiency at the start of treatment, at least once a week for the first 13 weeks and at least monthly thereafter. So in the observation, hematology and clinical biochemistry, the important criteria, the parameters, the hematological examination should be carried out in at least 10 males and 10 female animals per group at 3rd, 6th and 12th month interval, as well as at study termination if longer than 12 months. So blood samples should be taken from a named site, for example, by cardiac puncture or from the retroorbital sinus. So from the retroorbital sinus, which we are regularly doing in our institution, when animal is alive, and cardiac method is adopted when we sacrifice the animal. So this particular, both the process has to be done under the proper anesthesia. Following list of metallurgical parameters should be investigated. Total and differential leukocyte count, erythrocyte count, platelet count, hemoglobin concentration, hematocrit, that is packed cell volume, mean corpuscular volume, MCV, mean corpuscular hemoglobin, MCH, mean corpuscular hemoglobin concentration, prothrombin time. So these are the important hematological parameters which should be investigated and noted down to write down the result and the conclusion. The clinical biochemistry determination to investigate major toxic effect in tissues and specifically effects on kidney and liver should be performed on blood samples obtained from at least 10 males and 10 females as stated earlier. So following list of biochemical parameters should be investigated. Glucose, urea, creatinine, total protein, albumin, calcium, sodium and potassium, total cholesterol, at least 2 appropriate tests for hepatocellular evaluation. Earlier it was known as the SGPT or SGOT, that is alanine aminotransferase aspartate aminotransferase, glutamate dehydrogenase, total bile acid, and at least 2 appropriate tests for hepatobiliary evaluation. Alkaline phosphatase, gamma glutamyl transferase, 5 nucleotides, total bilirubin, total bile acid. So these biochemical parameters for each animal as given in the procedure has to be noted down, recorded to write the result and conclusion. Other clinical chemistry parameters may be measured depending on the toxicity of substance such as fasting triglyceride, specific hormones of our concern, and cholinesterase, which is very important in many of the cases. Particularly, this is the time period of the situation of World War-like situation where a lot of chemical weapons, war gases are used, which have direct effect on cholinesterase. Urine analysis determination should be performed on at least same 10 male and 10 female per group. So it has to be investigated for appearance, volume, osmolality or specific gravity, pH, total protein, and glucose. Other determination include ketone, urobilinogen, bilirubin, and occult blood. So this is about the biochemistry and biochemical parameter and hematological parameters in the observation. And now let us see about the pathology. So gross necropsy is a very important part of the pathology. All animals in the study shall normally be subjected to a full detailed gross necropsy. Necropsy, this term may little, make you confused between autopsy and necropsy. Autopsy usually performed on human beings after the death, but necropsy is on the animals. So it includes careful examination of the external surface of the body, all orifices, and the cranial, thoracic, and abdominal cavities and their contents, as we used to do in autopsy after the death of a human being, the mortuary. Necropsy need not to be applied in studies restricted to specific key measures such as neurotoxicity or immunotoxicity. So organ weight should be collected from all animals other than those excluded by the later part of the paragraph. Of course, this paragraph means here, as we have seen, I had written earlier with the specific key features. So the adrenals, brain, epididymis, heart, kidney, ovaries, testes, thyroid, more. The animals which are killed due to the progression of another disease or the infectious disease, उनको छोड़कर बाकी सभी में this is applied. So should be trimmed, these organs isolated, trimmed, that is make free from adherent tissue, and they make wet weight as soon as possible after the dissection so that it should not get dry. Should be noted down. And cap or for histopathological examination, the for intended subsequent histopathological. The histopathological examination should be the minimum histopathological examination. All tissues from the high dose and the control groups, all tissues from animal dying or killed during the study, all tissues, macroscopic abnormalities, target tissues show treatment-related changes in high dose group from all animals in all other groups, all dose groups. In the case of paired organs, kidney, adrenal, both organs should be examined. These are the some important histopathological examination criteria. Now we are moving towards the end, data and reporting. So data on the basis of observation following the restricted or being restricted to the prescribed procedure, individual animal data should be provided for all parameters evaluated as stated above. Additionally, all data should be summarized in tabular form as follows, showing for each test group the number of animals at the start of the test, the number of animals found dead during the test or killed for human reasons, and the time of any death or human kill. The number of showing signs of toxicity, a description of the sign of toxicity observed, including time of onset, duration, and severity of any toxic effects. The number of animals showing lesions, the type of lesion, the percent of animal displaying such type of lesion. Summary data table should provide the mean and standard deviation, of course, if applicable, the numerical result should be evaluated by an appropriate and generally acceptable statistical method, which might be studied by you people in during the PhD program and before in PG program. The statistical method and the data to be analyzed should be selected during the design of the study when you present in front of committee for the approval. Test report. The test report should include the following information. The first, about the test chemical, physical nature, that purity, physiochemical properties that has been already done during your dissertation or when you submitted your dissertation of the master's. Identification data, source of substance, batch number, certificate of chemical analysis, whatever applied. Vehicle, if appropriate, justification of choice of vehicle, if it is other than water. And it has also been mentioned about its LG50 or other toxicological profile of the vehicle available. The test animals, the species or strain used and justification for the choice you made for a specific strain or specific species of animal. Number of animals, age and sex of animal at the start of test. Source from where you had obtained the animals, the housing condition, the diet, etc. Individual weight of animals at the start of the test, at the end of the test, and during the test. The test conditions should also be mentioned in your final report. Rationale for route of administration and dose selection. When applicable, the statistical method used to analyze the data. Details of test chemical formulation or diet preparation. Analytical data on achieved concentration, stability, and homogeneity of the preparation. Route of administration and details of the administration of the test chemical for inhalation studies, whether nose, that is, if inhalation is performed. So it is a conditional. Actual dose, mg per kg body weight per day, and conversion factor from diet or drinking water test chemical concentration, that is in terms of ppm, if applicable. Details of food and water quality. Then what should be there in the result? The summary tabulated data and individual animal data should be presented in the result. Survival data, body weight or body weight changes, food consumption, calculation of food efficiency if made, and water consumption if applicable. Toxic response data by sex and dose level, including sign of toxicity. Nature, incidence, and duration of clinical observation. Ophthalmological examination, pupil size, etc. Hematological test, as described above. Clinical biochemistry test, as mentioned above. Urine analysis test, as already discussed. Outcome of any investigation of neurotoxicity or immunotoxicity. This is with reference to the objects before the study. Terminal body weight, organ weights, and their ratio, if applicable. Necropsy findings, a detailed description of all treatment-related histopathological findings. Absorption data, if available or applicable. Statistical treatment of result as appropriate. Discussion of result including dose-response relationship, consideration of any mode of action information, discussion of any modeling approaches, BMD and OAEL, as already mentioned above, determination, historical control data, relevance for human. So whatever the applicable things are there, that should be included in the discussion, and on the basis of the result and discussion, final conclusion has to be made. This is the detailed method. The most descriptive study, chronic toxicity, OECD 450. So here, final note, the toxicity assessment is as important as discovering and developing new pharmacological agents. I hope you people might have been made proper understanding, and if there is any question, then you may ask the question. Is still I'm audible?
Yes, sir.
I think everything is understood. Or so whenever you are comfortable, whenever you get time to visit the institute, you may ask the question after studying the proper content. Thank you for your patience listening. Thank you very much.
Thank you, sir.